Alina, and you're listening to Your PharmD Bestie. Hi everyone, welcome back to another episode of Your PharmD Bestie. My name is Alina, and I am the host of this podcast channel. Again, great thanks to Jimmy for supporting me through this journey and creating this podcast channel for everyone out there who's interested in learning more about pharmacy school process and pharmacy residency. So, brief recap of our last episode. It was just a brief introduction of this new podcast and also myself. And again, we did receive some listener feedback and comments, so we'll be addressing those during our episode today. Today's topic is prepping for pharmacy school applications and interviews. So we'll be covering some tips and tricks on how to manage stress and anxiety when you're going through the application process. Well, really, like with any application process, whether you're applying for like a job, graduate school, medical school, pharmacy school, there's a lot of stress that can go behind it. And so for me, I think something that really helped get through that process was really understanding what was required to complete the application and creating a timeline to ensure that I was getting all the parts in on a timely manner. So I knew that I was going to be nervous no matter what. So I focused on what I could do to be as well-rounded as possible and show that I was truly passionate about pharmacy and that I did my research. So this meant that I would reach out to conduct informational interviews with pharmacists in different areas to better understand their career and see like where I fit into that. And I also started on my application a couple months in advance so that I could give myself as much time as possible to complete it and not have to stress. I think it's also important to set realistic expectations. Like there will be some days where you're going to have like the worst writer block. And that's okay. I think that if it helps, set aside like a block of time throughout the week to just write down anything that comes to mind. And I can almost guarantee that you can formulate something out of that. It'll just take some time. And also give yourself grace during this period of time, especially if you're also handling classes, exams on top of the application process. Like it can be very overwhelming. I understand that. So, set realistic expectations, start early, really understand what your strengths and limitations are so that you can apply and know when to apply like relaxation techniques. If it helps to journal down what's stressing you out, and also then process those emotions and come up with a plan on how you want to improve or move forward with the whole process. So I want to encourage everyone out there who is currently or is planning to go through the application process for pharmacy school, like really know what you want to get out of this application and out of pharmacy school. Like, why are you applying to pharmacy school? Really figure out if the programs that you're applying to are the ones where you feel like you will learn the most to achieve whatever your future goal is and go from there. So start baby steps. So the whole application process, couple things to help boost your application. Yes, you've probably heard that GPA matters. And of course, I guess in general, like maintaining a strong GPA, especially in the prerequisite courses like biology, chemistry, maths, that's important. I would say, however, though, that pharmacy schools very much look holistically at your application. And so also focus on the experiences that you've had in healthcare or in pharmacy specifically. Make sure that you're getting really strong letters of recs from professors, managers, other healthcare professionals who can write strongly about your skills and how you would fit into that program, as an example, and also crafting a really strong personal statement. I had the worst writer's block when I was trying to write my personal statement, and I know a lot of people, me included, who actually ended up rewriting our personal statements pretty close to the deadline for some of the programs. And so that just goes back to like starting as early as you can. So when you do start sending your personal statement out to people for proofreading, edits, when they do make edits that you realize like, oh shoot, like I have to make a lot of changes to my personal statement, like you've given yourself time to make those changes and feel good about your personal statement and your application as a whole. So those are just other things about the application that I think you should really pay attention to. And I'll dive a little more deeply into each aspect of that. So GPA, I would say like this starts right off the bat when you enter undergrad. If you know what you want to do, great. If you don't, that's also fine. But making sure that you are meeting all the prerequisites that you need to apply for pharmacy school. And sometimes like your major doesn't require some of the classes that pharmacy school does, for example, like public speaking. And so meeting up with your academic counselor to figure out when during your years in undergrad are you going to take that class to make sure that you have met all the requirements to even apply in the first place. So make sure that your class schedule and course schedule is set and you're on track to completing that. And then I really don't know how relevant the PCAT is anymore, but some schools might still require PCAT. If you are strong in standardized testing, I'll say go for it. I think it's also nice to get a sense of what types of drugs there are and what information you might want to pay more attention to prior to going into pharmacy school. And I think the PCAT could give you some good insight on that. Other areas to help prepare for the PCAT would include like chemistry, biology, critical reading, and quantitative skills. So I personally didn't take the PCAT. It was not required when I was applying for pharmacy school, but again, depending on where you apply to, just make sure that you read up on what the requirements are in order to apply. I would say the part of my application that really probably gave me the most boost was the experiences that I had. So you don't have to have worked in a pharmacy setting to be a strong candidate, but obviously, like if you have had that experience, you are more familiar and you have had more hands-on experience with medications, patient care, and pharmacy operations. And even if it's having worked a year or a couple years as like a pharmacy technician, I think that's always great to mention. And from my knowledge, a lot of people who have worked in those settings also have a lot to speak to in terms of situational interview questions. So when was a time you had conflict in a workplace? When was a time when you had disagreement? How did you handle that? And I think these experiences really help to highlight your ability to manage a lot of those situations. And it really does show through when you're speaking in an interview. For me, I did volunteer at a hospital and also at a pharmacy free clinic. And so I think that highlighting your volunteer work and community service is also a way to show your commitment to patient care. Even if it's not directly related to pharmacy. As an example, I volunteered at UCSD Health for a couple of years, and I did not really touch medications during that time. But what I did gain out of that was understanding the dynamics and the interprofessional relationships in a hospital setting. So really seeing how hard nurses work and what that relationship is like with pharmacists, understanding kind of the scheduling and timeline from when a patient first gets admitted to the hospital to when they get discharged, and how a pharmacist plays a role in that, and how pharmacists communicate with physicians and nurses to make sure that patients are getting the appropriate medications and care that they need while they're in the hospital and outside of the hospital. And so I was able to speak to some of that during my interview because I had that experience. And I think for some of these experiences, yes, you do have to apply for them. If possible, I would even reach out to pharmacists in different settings to ask if you can shadow. And there are some obviously like regulations in terms of like HIPAA and ethics, whether you're able to do a lot in those settings, but even just understanding and seeing what a pharmacist does can really help you understand how you see yourself in that setting as well. Letters of recommendation, that of course also depends on the pharmacy school and what they want to see, but a lot of times it's going to be asking for letters of recs from your professors that can speak to your willingness to learn, as an example, how you did in class, how proactive you were to reaching out to get to know the professor, your classmates, or even just reaching out for help when you needed it. If you have a job, reaching out to a manager to ask them for a letter of rec, because that gives insight into what kind of person you are outside of an academic setting. It could speak to maybe who you are as a team player in your work environment. And it can also show that maybe you have other adversities outside of academics that you have to attend to. And so you're working other side jobs, and that those may not be related to healthcare pharmacy, but it's still who you are. And so I still think that it's important to include those in your application, and showcase as much of skills and experiences that you've had outside of just pharmacy and healthcare. And then pro tip, when you're asking for letters of rec, I've had this question asked so many times, but how do you approach someone to ask them for a strong letter of rec? Simply ask them, preferably in person, if they think that they are able to write you a strong letter of rec. And if there are certain characteristics or qualities that you want your letter writer to speak about, like talk about that too. Say like, like I've been in this class, I've really enjoyed learning. I've enjoyed learning about your research too outside of what we learn in class, and from our conversations and just like our interactions, I was wondering if you would be willing to write me a strong letter of rec. I believe that you can speak to X, Y, and Z for me. And it's really important to emphasize the strong letter of rec, because there are people who unfortunately may not be able to write a strong letter of rec, but maybe they don't want to turn you down. And so I would say that it's definitely more important to prioritize someone who can write you a strong letter of rec than someone who maybe is in a position that you think would be favorable for your application, but may not be able to write you as good of a letter. All right. And then finally, going into the personal statement. Again, this should be like a 1 to 2 pager, really highlighting your strengths, the reason you want to go into pharmacy school, the reason you want to go into pharmacy, why that pharmacy school specifically, and what experiences or skills that you have that make you a great candidate. Be genuine. You want to make sure that your passion shows through. And I think having read many personal statements in the past, we can tell when you're very genuine and passionate about something. And so I think those are usually always the personal statements that leave more of a lasting impact. If you have a story to tell, a personal story to tell, as an example, maybe you're going into pharmacy or healthcare because of a family member, or you've personally had an encounter that really impacted your decision. I think that being able to speak to that really shows your empathy and resilience as well, and shapes who you could be as a future healthcare professional. And once you have that draft done, make sure that you've proofread it yourself and send it to a couple of people. Ask your mentors, ask friends, colleagues to help proofread. I would say like 3 to 4 people at most, because sometimes having too many opinions can be difficult to figure out like what you want to prioritize and what you want to take with a grain of salt. But make sure that you do have people to proofread, because sometimes when you're writing, you may not have an outsider's perspective to tell you that, hey, like I think this part of the application is really great. Maybe this part you could dive more into and give more details to. Maybe this part we can reframe it into something else. And so always encourage having a second pair of eyes read over your application. And just to round out for the application process, again, keep in mind the deadlines. Make sure that you are giving yourself enough time to work on this and produce as strong of an application as you can. And even prior to the whole application process opening, if you're someone who's in like their first, second year of college and you're already thinking about this, great. One thing that you can do is start looking at different programs that you're interested in applying to. And also in the meantime, document your experiences and reach out to people to gain more information. So when I was doing informational interviews, it really gave me insight on what specifically in pharmacy that I was interested. And I realized that like, hey, wow, I didn't know that pharmacists could work in informatics. I didn't know that pharmacists could work in pharmacoeconomics. I didn't know that pharmacists could work in industry and in the hospital. And so I was able to really craft a detailed application that showed that I understood what I was going into, and that despite the things that I learned, like this is the pathway that I want to go into and I'm confident in that. So next thing I wanted to speak briefly about is interview preparation. So with any interview, when someone approaches me for advice, I say first look up like the top 50 most common interview questions that you could be asked in any setting, like whether you're applying for a corporate job, healthcare, school, whatever. Because common questions will definitely probably include like, tell me about yourself. What are your top 3 strengths? What are your top 3 weaknesses? And then there are also situational questions that are very commonly asked really in any setting. That could be, for example, like describe a challenging situation. How did you handle it? Describe a time when you had conflict with someone or disagreement. How did you handle it? Let's say someone from your team is not pulling their weight. How would you handle that? So those are the types of situational questions that I would prepare for. And when you're preparing for these situational questions, very important to practice with the STAR method. So STAR method stands for situation, task, action, and result. And you want to make sure that you touch on each one of those when you're trying to give an example to answer a situational question or a behavioral question. And usually I would say for situations, I've seen kind of like a downfall is people tend to dive really deep into the situation when really, if you think about it, when someone asks you a question like this, they want to know how you handled it, the action taken, and what the result was. So speak briefly about the situation, just enough that you can entail what was happening and what led you to do what you did and what the result was. So I would aim for around like 1 to 2 minutes for that first part, like situation, task, and then dive a little bit deeper into action and results. When you're preparing for interviews, again, I feel like after COVID, this was a little more noticeable when I sat in some interview panels, but you always want to leave a good impression. I think COVID was definitely a time where we could all sit in front of the camera during an interview and like you wouldn't be able to see that I was wearing like pajamas at the bottom. But please come with professional attire. Please come dressed to make an impression. Please be punctual and just remember, basic interview etiquettes. Be respectful, be on time. Make sure you have questions to ask at the end because believe it or not, sometimes people will say it's okay if you don't have questions, but if you do have questions, it's really a bonus because it shows that you're really invested in what you're about to get yourself into, and it shows that you're interested and you want to learn more about the school or the job that you're applying to. For pharmacy school interviews specifically, make sure that you have researched the school in advance, that you know what the school's mission is, you know the value, you know the curriculum. Maybe there are certain aspects that stand out about that institution. For example, maybe the pharmacy school you're looking into is geared towards clinical practice more, or maybe they have a really good presence in the industry. So you can definitely speak to those if they ask you during the interview, like, why our school specifically? Other common questions to prepare for include why pharmacy in general and what makes you stand out as a candidate, or why should we choose you over another candidate? So that again goes back to knowing what your strengths are and being able to speak to it and have a couple of examples to back up what you say during the interview. So that takes us to the end of this episode. I know that it was a lot of information, and so feel free to reach out to any of our pages to ask questions, or if you have anything that you want to learn more about, feel free to reach out and leave a comment as well, and we'll make sure to address those at the next episode. Again, we encourage all listeners to submit questions and really any topic that they want to be addressed for the next episode, and we will answer those. All right. Thank you again for tuning in to this episode. A reminder to subscribe, leave some reviews, and follow us on social media if you enjoyed this and really just want to hear me talk. I'm trying to improve my ability to be a better speaker, and so your support means a lot to me. Again, highly encourage you leave questions so I can address those in the next episode. Thank you again.